Welcome back, everyone. This is Nicia, the founder and organizer of Fibro Patient Education and Support. And we are back today with our digital series on Black Menace, Survival Steps to Beat COVID-19 for African American. And my guest today is Dr. Chi. So Dr. Chi, she is a former college athlete turned MD and entrepreneur. As a first generation Nigerian American, Dr. Chi allowed her culture and faith to shape her values with serving others. She played 4 years of college basketball at the University of South Florida. And although she loved basketball, Dr. Chi knew that her real passion was for medicine. And she enrolled in medical school in 2011 and obtained her MD in 2015. And Dr. Chi currently practices medicine in the state of Florida. And she's also an MD hospitalist. So welcome, Dr. Chi. How are you?
I'm great. Thanks for having me.
Thank you. I'm so glad that you're here for Black Menace Survival Steps to beat COVID-19 for African Americans. And since you work in a hospital setting, I would like to learn more in terms of what have you seen on the front lines there in the medical facility? What has been your experience?
It's been quite an interesting experience altogether. So we're kind of in months into the COVID since it's happened. So a lot of things have changed, evolved since February and March. In the beginning, it was a very scary and overwhelming experience because we didn't know what to expect. We were very cautious and overprotective because we just heard about it from other countries, and so when it came here, we were everyone was kind of on eggshells of what to do, and there was rules changing every day. We would get emails from administration every day about what to do, what not to do, wear masks, don't wear masks, patient has to wear masks, we don't know if we should touch them, so there's so many different changes and rules that have gone on since February. But I will say since it started to now, it's a little bit less overwhelming and frantic because we kind of, not saying get a hold of the virus, but we got a hold of how to manage the issues that is arising every day. And when there is an outbreak or if there is a patient that's positive, we're more collected of ourselves and we're able to put on the appropriate PPE and know exactly what to do to protect ourselves and our families in order to not get the virus, in order to not spread it and have exposure everywhere else. So it's been a roller coaster ride, long story short, but at the end of the day, we're doing our best that we can in the hospital to take care of ourselves and our patients.
Now, as a doctor yourself, do you all, have you experienced this? Any shortages and having PPE equipment? Because I've heard that in some facilities due to the virus, is in demand where all facilities may not necessarily have enough of it to go around.
So in the beginning, I don't think we had a shortage, but they were rationing just in case there was a shortage. And so we were having to reuse N95 masks at that time, not saying they didn't have enough, but they were preparing for the worst case scenario. And yes, I have heard of cases, especially in New York, where they were short. But at the present moment, we are not technically short, but because this is still the beginning of a pandemic, in my opinion, and there's a long road ahead of us, I'm not sure what the future will hold. But as of now, we are protected and we do have the necessary PPE for us.
That is good to hear because this is May. I'm in the state of Illinois, as I shared with you, and it's still scary for many people because some of the states, they've totally reopened. Here in Illinois, we have not totally reopened. I heard yesterday that in Wisconsin, which is a neighboring bordering state, as well as Indiana, a bordering state, that they have reopened. And so it's scary because if you're in a state that has not reopened like we haven't, and these other bordering states have, my concern is if people are crossing the border in and out, from Wisconsin to Indiana, that this can just erupt all over again, and it still has not fully quieted down.
Right, exactly. That's what we have to be careful for because I'm in Florida and we have opened some of the state, but we're in phases. And then they'll start opening different things like bars and restaurants slowly, depending on what happens. But it is scary because the hospital, that doesn't change anything. We're still getting positive patients. The numbers are still there. It's not like it just disappeared just because we want to be free. COVID is still out there. We're still treating patients that are positive. There's still outbreaks in the facilities, nurse facilities. So it's still real. I mean, it's just because it's open doesn't mean it stopped.
That's true. Now, Dr. Chi, in terms of the Black and Brown community, what tips would you recommend or suggest for many of us? Because some people, number one, have not been tested for COVID-19. You know, they may be feeling poorly, but they may not have been able to get tested. And for those who, it's really two questions. For those who have not been tested or who do not know if they have it or not, what are some things that we should be focusing on to protect ourselves?
So it kind of goes back to having trust within the health system. I know a lot of African American communities it just started from there and stemmed from the not trusting the healthcare system enough to go get tested or to get treatment. And so we're ended up in a society where we are withholding ourselves from treatment or even not having the appropriate treatment or insurance to get the appropriate testing done. So it's just needing to encourage those to seek out the testing. It's difficult too still because they're not testing everybody. There's not enough tests to test everybody. So even if you have a little bit of a symptom or you aren't symptomatic, they're not going to test you unless you meet certain guidelines. And so that's still a problem and for all the population, but especially for the African Americans who already have that one, we already have things against us. So it just makes things even worse. And I know in like Illinois, I know the numbers are astounding in the African American community in comparison to the white counterparts. And it is disturbing. And the only thing I can really say to that is we have to reach our family members and our friends and encourage them to demand health care and to demand to be seen and to be taken seriously. If they say no the first time, go back. And don't accept no for an answer until you're really treated appropriately and seek the attention that you need. Because if they send you home and the next thing you're going to be in the ICU when you really needed that attention because they put us to the side. And that's common. So the encouragement is the people, the younger generation, to encourage the older folks to just seek help and demand attention when it's needed.
That's so true. And that's pretty much has been, I think, one of the most constant things throughout this digital series. Speakers prior to you have been saying the same thing, you know, find your voice, speak up for yourself. And like you said, if you go, you know, keep going back, speak up for yourself, you know, demand that you be tested, do something. I don't feel that we should be saying, okay, well, I'm just going to go back home. You know, we need to speak up and ask for help. And I think the other part of this is, for some people, due to how they used to do years ago with the Tuskegee experiments, a lot of Black people are not trusting, you know, of the healthcare establishment. But because we don't want to be experimented on, you know, they've done that enough, you know, so we want to, you know, there shouldn't be any healthcare disparities. This is something that is an opportunist, and that COVID, in my opinion, doesn't care. And research has shown doesn't care if you're Black or brown, white or red or whatever you are.
Right.
You know, it doesn't look at you and say, okay, you're this color, we're not going to attack you. It doesn't care. We just need to make certain that we're getting the right treatment for us and that we speak up for ourselves and also our loved ones. So in terms of, for you in Florida, in terms of what you've been seeing, do you have patients who have come in, those who have successfully recovered from this? What has been that experience like?
Yeah, so I luckily have personally experienced patients who were positive and have been treated appropriately and been able to go home in a good, stable condition. But unfortunately, I have colleagues that had the opposite effects, where they had patients that came in and it was too late and there's nothing much they can do. So this COVID is still a phenomenon when there's so many things that spiral out of control when it comes to beating the virus. And there's different complications that we're finding out that is very rare in other viruses, like susceptibility to clots. That's something that has been found to be an increased risk factor. And so now we're putting patients on what we call like a prophylaxis, so they don't
Okay.
clot when they're diagnosed with it. So there's so many different medical treatments and management plans that are changing constantly with more studies and more patients being evaluated on a daily basis. And this thing just keeps changing. Everything is changing, and we have to stay up to date. This is new for all of us, so we're trying to do our best. But my patients, luckily, they've been good so far. I just can hope and pray that it continues that way.
That's true. And they're also saying that with the coronavirus, that there's new symptoms that keep creeping up that before maybe was not an issue that now they're now learning about, or they're seeing more of. And it's just scary because you just don't know. And
Yeah.
what's frightening is businesses that are reopening, and we have a lot of Black and brown people, as well as other people who are working in, let's say, whether it's a restaurant, or let's say they are caregiver in the nursing home in different places. These are people who cannot work from home. So they're there. So if, let's say, you're someone, Dr. Chi, where you're not able to work from home, so you must go to work, how do they protect themselves? What would you recommend?
So those who have to go to work and it has to be outdoors and you're around people, definitely wear a mask. And it's not just wearing a mask and pulling it down all the time. You have to secure yourself and wear it above your nose and under your chin, and making sure that it is secure. And after you're wearing a mask, and making sure you're washing your hands and actually using alcohol all the time. So soap and water is great. 20 seconds every time you wash your hands, really lathering very smooth, really rigorously in there. But I also recommend alcohol is a big factor when it comes to killing viruses. Just making sure it's more than at least 60% or 70% of alcohol. So constantly using alcohol around your hands, because we're constantly touching our face without knowing it. We're touching objects we don't really know about. And when you're at work as well, wiping down your work area, workspace that is for you with Lysol and bleach cleaners, to make sure that you are killing the viruses or any type of bacteria that is around your space, to make sure that you are safe. And just remember, when you're going to the bathroom and to the other part of the office, that you're still being in contact with different things all the time. So making sure you keep that alcohol right in your pocket every time something changes, because again, you never know. And I feel like at this time in May, I catch myself too. I'm being a little bit more light, like taking it more light than I was earlier. Like I was very cautious before, and now I'm kind of sometimes being more lenient with things like, oh, I forgot to wash my hands. That's okay. But it shouldn't be like that. We still need to be on our toes 100%, because again, I think we got a little bit lax because we're tired. we're tired of this virus, but this virus isn't tired of us. It's still here. So just remember to just still be OCD about everything, because it's going to make a difference.
Now, when you mentioned the alcohol, are you talking about those hand sanitizers with alcohol, or are you talking about little bottles of alcohol just to pour on our hands, or can you clarify that?
Hand sanitizer that has at least 60% of alcohol concentration.
Okay. And some of the stores, it's hard to even find hand sanitizer, or they price them at an outrageous price. And some people have found recipes on YouTube where they have purchased, the aloe vera plant itself. I've seen in the grocery store, and then they'll purchase the 60 proof, alcohol, and try to make their own hand sanitizer. And it's unfortunate, with all this price gouging, because I've seen little bottles, let's say like this, believe it or not, some of those for $30.
Wow. Yeah, that's not right. That's not right. People are really making money off of this pandemic.
They are. And if you don't have, let's say you're on a limited income, fixed income, you don't have a whole lot of money, or you don't have an extra $30 for a hand sanitizer, that's just really sad. They should not be permitted to price gouge. I know people need to make money, but during this time, where's the compassion?
Exactly.
Yes. Okay, so in addition to that, what about in our home? So when the mail comes, and I thought about this the other day, the mailman comes, they bring you your mail, okay, and what is our first reaction? To bring the mail into the house. You get packages. So the other day, this week, I've received several boxes in the mail. So now what I've been doing is I don't bring them in the home. I open them outside or in the garage, take what's inside of that, wipe it down, then bring it in the house. But I leave the boxes in the garage because I'm afraid to bring all that stuff in the house because you just don't know. Because I heard that the
It's
virus,
traveling a lot.
yes, I heard that the virus can even live on packaging.
Mm-hmm.
So
Yeah,
much about.
it can live on different depending on type of surface. It can live on surfaces for hours to days, even depending on what surface it is.
Okay, so let's say you're going shopping at the grocery store. Um, is it true that when we go shopping at the grocery store, that when you leave the grocery store, when you get home, those clothes you have on that you wore to the store, you should be taking those off immediately as well as showering immediately? Or is that being overly precautious?
I think that's being a little bit overly precautious. I'm not that particular about that stuff. Because then you start thinking, oh, it's living in the air, and then it goes on my clothes, and then I have to wash my clothes. I think that's a little bit being a little overdone, and then it's like then you can't even go outside anymore, and then we just get a little bit too scared. I think that might be a little bit too much. So I think
Okay.
I think we're good on that
Yeah.
part.
Now, can heat kill this virus?
So this virus is a little different. Studies are still being done as far as heat goes, because usually viruses don't live that long in a warm environment or summertime. But as you can see, we're in Florida, or I'm in Florida, and it's hot, and the virus is living. So can heat kill it, like deactivate if you put it in a really large, like high containing heat? Possibly, yes. But can it survive in the hot summer? Yes, it
Mm-hmm.
can.
Mm-hmm. Yeah, because I was just thinking that this is May. I'm in Illinois, so we have a lot of cases here. Schools and everything is shut down. We have not totally reopened yet. So I feel that we still have a very long way to go before we get to that point where, maybe we can let our guard down. But the more I think about it, I don't think that even when things return, as they say, normal, I don't think it's going to be the old normal. I think there's going to be a new normal, even if that makes sense. More awareness as to, number one, don't take life for granted. You never know. Do your due diligence. Make
Yeah,
certain you're taking care of you.
basically, yeah.
Yes. So as a physician, what do you do to take care of yourself? You come into patients all the time in a hospital setting. You have family, friends, loved ones too. So they want you and I want you too to be safe. So
Yeah.
what are things that you do?
Personally, for me, actually for my mental state and to be sane, I continue to work out and do that almost every day. Try to do at least 5 to 45 minutes of physical activity, whether that's yoga or walking or some high intensity, just to get that stress out of my system. Because if I'm not okay, my patients won't be okay. Because if I'm stressed and losing it, I won't be able to treat them efficiently. So I do that, and I meditate and I pray. And I think my faith and my spiritual side has been what has been keeping me together through all of this, and been able to shed light with other people about the COVID and how to protect themselves, because it's overwhelming. So those are some things that I do for myself. And unfortunately, like, I'm a traveler. I love to travel. So this staying in one city for a long time is killing me. So I
Yeah.
have to be creative and go out and take a walk and look at different views because I need it.
Yeah. I feel you on that. I think I may have shared with you before that my husband and I had traveled to Hawaii, and we were there in February, and we got back just in the nick of time before they were saying, if you travel there, certain things you can't do. And so we got back just in time. And now I have since heard where, if you travel there, they want you to be quarantined. And I thought, wow, I'm so glad we went when we did. And we got back when we did. I love to travel too, but right now I can't think of any other place I'm going to go anywhere the remainder of this year.
Right, exactly. We're not going nowhere.
No, I think I may have to resort to just National Geographic and looking at
Yeah, that might work.
Yes. So tell me about your not-for-profit, Reality Speaks.
Yeah, so Reality Speaks is a nonprofit I found when I was in med school. I used to play basketball, you mentioned, and I felt like there was a need for athletes to explore outside of the sport. Because when we're playing, we never really know what we want to do because we're so focused on our sport. And so Reality Speaks was formed to help these athletes start thinking outside the box and to help them think what else can they do and how else can they give back to their community while giving back to or while improving their resume and learning the appropriate skills to succeed after sports. So from that, I started doing community events and community charity things that the athletes will come and volunteer to increase their resume. And since then, I've just been in the community stemming from Reality Speaks. So we do annual clothing drives, we do Christmas toy drives, we do Thanksgiving dinners, things like that for the underserved here. And so now with COVID, and we've kind of been on lockdown, but I still want to do something to help the community. So we looked into some homeless shelters and places that are still in need, even before and after COVID, they're still going to need some things. So we're trying to get back to them, more of some toiletries and anything they could use that could help them during this time. And sometimes I'm thinking of even giving them some food, but those are so temporary. I want something they can actually use and need. But, giving back is what we need to do for people who are blessed. I always feel like they should share their blessing. And so that's what Reality Speaks really does.
I like that. And you're right. Give back, because to whom much is given, much is required. And, food is always a good thing to do, but they also need things in addition to food. Like you mentioned, it could be toiletries, personal care items, because I think about now that, socks, for example, gloves, masks, personal hygiene items,
Right.
that they from hand sanitizer. So are you all, do you accept donations from other people if they want to donate supplies? Or how would you like people to donate to the organization?
So for those who want to donate, because we are planning on giving back within the next couple of weeks, they can go to the website, realityspeaks.org, and there is a donation link there, and we will accept donations from there. And from there, we would end up buying the items ourselves that would give back to the community.
Yes, because I was thinking about that as I mentioned donating things. It'd be better just to make a donation instead of shipping, because the virus
Right.
can live.
Exactly. We'll take care of it on our end just to limit the exposure.
Oh, most definitely. And so, question for you. So how do we move forward? What are some things that we need to know to move forward? Because it appears from what I've been told and what I've been reading in my local news that even when some things reopen, and I even heard, I believe it was Dr. Fauci make the remark that come, I think it's September or the fall or maybe even next year, we can see ramp up again.
Yeah. So how do we move forward? I honestly, my honest answer is just to be patient and to be strong, because I know we're very antsy and we're ready to open up the economy and just have at it. But I think the way to move forward is to be patient and let the recommendations come as they go. And even if they're saying the state is open, be smart about your risk factors and what you have to risk. If you aren't comfortable, don't risk yourself because the government said you're free to go. Educate yourself, do the appropriate research. And if you're still questioning things, ask your doctor what their opinion is about, their recommendations and your health. So, moving forward, still wear the mask, still wash your hands, still keep the hand sanitizer close to you so that you can still prevent yourself from catching this virus, because it's still there. And coming to the winter, they're saying it might be a dark winter. Like we have not only the COVID, but we still have flu season. That's still real. It's still a real thing that people forget, that people die from flu every year. Hundreds of thousands of people die. So it's going to be scary. But be patient and be strong and keep your loved ones close together and just be patient.
Yes, and I think that patience is a virtue.
Right.
You know?
Exactly.
Yeah. So I thank you for your time today. And you're right. You also said some other things that were golden nuggets. You mentioned about meditation, prayer, and exercise. And so right now, for those maybe that don't have exercise equipment, what are some things you may recommend that they can do? One thing I think I may have mentioned, I'm not really certain, is I'm buying a jump rope and one of those total gyms and a hula hoop, because I figured you got to stay active. You got to have some type of physical activity for your body.
Right. I honestly don't have any equipment. I don't have any gym equipment, but I work out constantly with, even if you get a mat. And there's so many YouTube videos out there, you'll be impressed what you can do at home with just a mat or a rug. There's yoga videos, there's Pilates videos, there's actual, working out videos where you get your heart rate up of HIIT workouts. So there's so many things you can do with just a phone or a computer and YouTube, and just see what's right for you. If you dedicate 30 to 45 minutes a day, 5 times a week, you're in that range of self-care and cardiovascular health. And honestly, it's good mental health too, mental stimulation, because honestly, that is what I need. And if you're not working out, take a walk, take a nice little walk around your neighborhood, and just enjoy life, honestly, and being alive, because a lot of people can't say that.
That's true. And that says it all. I mean, it does. A lot of people can't say that. So I feel that those are excellent points, and we need to make the best of it. Like you said, be patient. You can't always get what you want when you want it. Just be patient and wait on it. But in the interim, I find that your mental health is vitally important.
Right.
You've got to make certain that is intact, because if that's not intact, you will literally drive yourself crazy.
Exactly.
Yes. Well, I thank you for your time today. And is there any other comments or feedback you would like to add?
No, I just thank you for having me. I just want everyone to stay safe as much as they can and just protect yourself and to own your health, because you're the only person who can do that.
Yes. And if you wouldn't mind, can we have the URL again for your not-for-profit?
So my nonprofit is realityspeaks.org. And I actually have a personal email or personal website as well that you can actually get that link from, as well as thedrchi.com.
Okay. Thank you so much for your time. I really appreciate you taking part in this digital series. Thank you so much. Enjoy the rest of your day. And you yourself safe.
Yes, I will. Appreciate it.